am Olivia Jackson Okeke. I'm a graduate nursing student of UT Arlington in Texas. This PowerPoint presentation is part of the Nurse 5342 Management of Nursing Operations in spring of 2025. It is taught by Dr. Castillo and also Coach Hazel. Good day, everyone. I am presenting to Board of Governors of Vibra the comprehensive strategic and marketing plan with operating projections of Vibra healthcare organizations so that it can be adopted. Vibra Hospital in Richardson, Texas is a long-term acute hospital that offers acute wound care, respiratory care, ventilatory management, and various medical needs to the community in North Dallas and nearby towns. The Richardson Vibra Hospital in Texas is one of the 45 entities nationwide. Cities and towns in the United States 2025 had described Richardson as situated in northeastern part of Texas. In Dallas County, it's part of the Dallas-Fort Worth Metroplex with a population of about 99,000. Vibra is coined from the vibrant, innovative, bold, relentlessness, and ambitious, which is the way that the entire company deals with the patients. There's also the mission, vision, and values, which is to provide efficient and excellent clinical services to patients' wellness and promote culture that inspires staff, patients' families, and the communities. The model of care. Vibra uses multidisciplinary care to offer intensive, continued medical management for complex chronic conditions. They offer extended stay, rehabilitations, stabilizations, eventual discharge through using specialized providers. Strategic plan. We utilize strategic planning to implement additional setups like establishing a mini surgery unit for wound care debridement under conscious sedation with or without ventilatory care to accommodate increasing patients' needs of our population. Bauer et al. In 2024 had a study done that showed that cost of a stay in a long-term acute care hospital, the LTAC, is far more cost-effective than executing these procedures in acute hospitals. Resources that will be needed are specialized staffing team. The goals for the year will include, for the first year 2026, remodeling, training, recruiting special manpower, starting operations in the latter part of the year. In 2027, which will be the second year, we're going to continue having training and also increased operation in volume. In 2028, the third year, there will be increased operational volume and also maintain competencies and keep staff turnover down. Now, also we're going to review the strengths, weaknesses, and opportunities and threats that may apply to Vibra with the new services. They are also going to analyze revenue and expenditures, determine the variance analysis as we incorporate them. The marketing plan. We're going to use marketing mix, which involves the 4 P's, the product, promotion, price, and place to influence the consumer. We're going to analyze external and internal markets and get them stabilized. We are also going to maintain healthy relationships with the payers of Medicare, private insurance, and private payers. We're going to promote activities via advertisements, good benefits, word of mouth. We're going to also involve different departments like the HR, the human resources, public relations, patients, employees, local media to promote the new service within the first 3 years. We're going to also put measures in place to monitor public opinions, monitor the outcome of projected revenue and break-even. And of course, we're not going to ignore the potential disruptions that may occur, like the staff turnover, loss of revenue from poor images or non-compliance with the government regulations. The product service line. This new service will involve adding mini surgery for wound management in-house to improve lives of people or patients, and also other model of care services as already discussed earlier. Volume projections. We're going to be using data for revenue analysis from the sample provided in the course, since I'm unable to obtain Vibra's revenue information. Estimated revenue generation will show no profit in the first half of the year, but volume is picking up later part of the year, of the first year, as shown in the Appendix A. The second year, 2027, we're going to have, as Appendix B shows, we're going to have an increase in 10% in revenue and also increase in the volume of the services. The Appendix C, which is the third year, 2028, we're going to have volume picked up in that year, 15% increase, and then break-even should be showing too. In summary, I hope from this presentation that the project will be approved by the boards. And again, since the new service that will be added will improve Vibra's care to the community and the nation, it also will align, or it does align with the mission, values, and vision of Vibra. We'll also put Vibra in a positive name to the Dallas-Fort Worth and also the nation. And again, it will also yield favorable variance analysis from the revenue projections. I and Malachi, Keziah, my lovely dogs, we appreciate your time and your attention. I'm available for any questions, or you can put them in the chat for me and I will be able to reach out to you. Thank you for your time. These are the references.